So, may I have your attention? We're really delighted to welcome you all here tonight. And we are in, I think, for a very special treat. My name is Ole Fine. I'm the local chapter chair for Physicians for a National Health Program, the New York Metro chapter. And it's really good to see such a wonderful crowd here tonight. Let me take this opportunity to say that putting this night together was really a task that our new executive director took on, and I think all of us should give her a great applause. Lori, will you raise your hand? Lori, Wen, raise your hand so people see who you are. And also standing in the back, you know, the fortune of our being able to use this facility for this activity has everything to do with Dr. Len Rodberg. So tonight we're going to hear from Wendell Potter. Mr. Potter was actually born and grew up in Northeast Tennessee, in the mountains of Appalachia. He then went to the University of Tennessee in Knoxville, Tennessee, where he majored in communications and earned his bachelor's. From there, he went on to become a journalist, an activity that he undertook for about 5 to 6 years, working for newspapers in Memphis, in Knoxville, and in Washington, D.C. He then decided that he would go into public relations and started to do that with a nonprofit health system in Knoxville, the Baptist Health System, and from there was recruited to be one of the PR people for Humana in Louisville, Kentucky, in 1989. He was there for about 4 years, and from that position was attracted to Cigna, where he was vice president of corporate communications. Cigna is, as I understand it, the 4th largest health insurance company in the United States today. In that position, he really learned what a health insurance company does. And we're going to hear, I'm sure, a lot about that. But apparently, one of the things that really irked at his conscience was in 2007, witnessing remote area medical in Virginia. This is a group of doctors that provides free health care. They do it essentially for a period of a weekend or a week. And there were just these enormous lines of people waiting to see these doctors in, you know, essentially made up examining rooms. And the problem was they had no health insurance. So in 2008, he resigned from Cigna and then began to explore how was it that he could, in fact, express his conscience. He has now joined the Center for Media and Democracy, is also an analyst for the Center for Public Integrity, and in October of 2009, produced this book that you all have seen, Deadly Spin. An insurance company insider speaks on how corporate PR is killing healthcare and deceiving Americans. So put your hands together and let's welcome Wendell.
Thanks very much. Boy, am I impressed with this crowd. I'm very honored to be among you all. Let's see. Should I talk closer?
No, you don't have to get closer.
All right. Very good. Thanks. I've often said that I truly am honored to be among people who spend a lot more time advocating for real reform than I have. So I'm humbled to be among your midst and truly honored to be invited to speak to you tonight. I'm going to start by reading something from the book. I don't often do this, but I wanted to read something that you may scratch your head and wonder, why am I reading this? And it's not specifically or directly pertaining to healthcare, but I think I'll explain the relevance in just a few minutes. It's in this section called the Playbook, and this is the part subheaded Big Soda. With evidence mounting that sugary sodas and other beverages are a leading contributor to the obesity epidemic in the United States, Congress, some states, and several American cities have considered imposing a special tax on the drinks to reduce consumption and also generate needed revenue to help pay for municipal services. In early 2010, Philadelphia Mayor Michael Nutter proposed a 2-cent per ounce tax on all sweetened drinks, and in Washington, D.C., City Council Member Mary Cheh proposed a 1-cent per ounce tax on bottled and canned soda that contains sugar. Alarmed, the beverage industry sprang into action to defeat efforts to impose a special tax of any amount on its products. Among the first things the industry did was hire a big PR firm to set up a front group, Americans Against Food Taxes. Funded primarily by beverage and food companies and their lobbying groups, AAFT was formed initially to fight a proposed 3 to 10 cent tax on sodas and other sugary drinks that healthcare reform advocates in Congress had once proposed to help pay for the expansion of insurance coverage in the new healthcare bill. To obscure its real source of funding, AAFT describes itself as a, quote, coalition of concerned citizens, responsible individuals, financially strapped families, small and large businesses and communities across the country, opposed to any government-proposed tax on sugar-sweetened drinks. But as disclosed on the Center for Media and Democracy's SourceWatch website, the group's membership really consists mainly of lobbying groups for packaged food and soda companies, chain restaurant corporations, and large food and soft drink manufacturers and distributors, including the Coca-Cola Company, Dr. Pepper, Royal Crown Bottling Company, PepsiCo, Canada Dry Bottling Company of New York, the Can Manufacturers Institute, 7-Eleven convenience stores, and Yum Brands. The Center for Media and Democracy's investigation found that the group's website, www.nofoodtaxes.com, is registered to Goddard Clausen, the PR and advertising firm that conjured up the Harry and Louise commercials to help defeat the Clinton healthcare reform plan in the 1990s. Using the, quote, we're part of the solution tactic, which I describe in the book, AAFT launched a campaign to persuade Americans that beverage companies are doing their part to get kids to cut down on their consumption of high-calorie sodas. The group has used ads and email blasts to boast that soda companies have replaced full-calorie soft drinks with, quote, smaller portion and, quote, portion-controlled beverages, real juice and bottled water. Voila, their products are suddenly no longer the problem. They're part of the solution. Even better, now they all get kids to buy more bottled water, which costs the companies next to nothing to make, at $1 a bottle more than they would have paid for a soda.